ADHD, or attention deficit hyperactivity disorder, is like having a brain constantly tuned to a different radio station. In children, it can mean a whirlwind of energy, a struggle to stay focused, and an impulsive streak that keeps life interesting. But behind the chaos lies a complex neurodevelopmental condition that, with understanding and support, can be managed effectively, helping these vibrant young minds shine.
Hi, my name is Soraya, and my infomercial will be about ADHD. Attention Deficit Hyperactivity Disorder is a neurodevelopmental disorder that manifests in childhood. It is a chronic condition that persists for many into adolescent and adulthood. Core symptoms of ADHD include hyperactivity, impulsivity, and inattention. The symptoms affect cognitive, academic, behavioral, emotional, and social functioning. So here we have a picture of what hyperactivity and impulsivity may look like in a child. As we can see, they're excessively fidgety. They have difficulty remaining seated, such as at school. They're always feeling restless. They have difficulty playing quietly with others. They're difficult to keep up with. They always seem like they have to be on the go. They excessively talk, difficulty waiting turns. They blurt out answers too quickly, or they interrupt or intrude others. And then symptoms of inattention, we may see that the child has failure to provide close attention to detail. They have difficulty maintaining attention in play, school, or home activities. They seem not to listen even when we directly address them. They fail to follow through, such as in homework or chores. They have difficulty organizing tasks or activities. They avoid tasks that require consistent mental effort. They typically lose objects required for tasks or activities, such as school books or like their soccer or sports equipment. They're easily distracted by relevant stimuli, and they have forgetfulness in routine activities like in their chores. So severity of these symptoms can vary from one individual to the next and can range anywhere from mild, moderate, to even severe. To meet criteria for ADHD, these core symptoms must impair function in academic, social, or occupational activities. The DSM-5 criteria requires for a diagnosis of ADHD six or more symptoms of hyperactivity and impulsivity, or six or more symptoms of inattention. The symptoms of ADHD overlap with a number of other conditions that, as a PCP, we must consider as differential diagnoses. These include developmental variations, which consist of intellectual disability, giftedness, and behaviors that are within a normal range for a child's level of development, neurologic or developmental conditions that can mimic or occur with ADHD. These include learning disorders or communication disorders, autism, and neurodevelopmental syndromes such as Klinefelter syndrome. And emotional and behavioral disorders that can mimic or occur with ADHD include anxiety disorders, mood disorders, occupational defiant disorders, conduct disorders, OCD, substance abuse, PTSD, and adjustment disorder. Medical conditions that may have clinical features that can mimic ADHD include hearing or visual impairment, lead poisoning, thyroid abnormalities, sleep disorders, tics, or medication effects such as with albuterol. Primary care providers play a crucial role in the long-term management of ADHD. PCPs prescribe and monitor medication for ADHD, such as stimulants or non-stimulants, adjusting dosage and type based on the child's response and side effects. PCPs can also provide guidance on behavioral interventions such as parenting skills training or school-based accommodations to help manage symptoms of ADHD. PCPs serve as the central point of contact for coordinating care among specialists, therapists, and educators involved in the child's care. In addition to regularly monitoring the effectiveness of therapeutic interventions, it is important for the PCP to provide information to the caregivers and child about ADHD, help the caregivers set specific treatment goals, and offer information regarding local support groups. By fulfilling these roles, the PCP plays a vital part in the comprehensive and ongoing management of ADHD in children, contributing to improved outcomes and the quality of life for the patient and their family. Anticipatory guidance that involves a child and family dealing with ADHD involves providing practical behavioral strategies, including setting clear expectations, using positive reinforcement techniques, and implementing routine and structure. You must work with the family and school to develop an individualized education plan or an IEP that includes accommodations and modifications to support the child's learning needs. You must encourage activities that promote socialization and provide opportunities for the child to practice communication, problem solving, and emotional regulation skills. Make sure to emphasize the importance of self care for both the child and the family by encouraging healthy lifestyle habits such as regular exercise, adequate sleep, and a nutritious diet. And ensure to schedule regular follow up visits to monitor the child's progress and make adjustments to the treatment plan as needed. By providing anticipatory guidance in these key areas, PCPs can empower families to effectively manage the care and support the overall well being of the child.